All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have Dr. Nicole Shirvani. Welcome to the podcast.
Hi, great to be here.
Yeah. So, why don't you tell us a little bit about who you are and what you do, how I like to begin most of my episodes?
Sure. I'm a psychiatrist. I specialize in women's mental health and integrative psychiatry, and I'm here in the Tampa area.
And how long have you been here?
I have been in Florida for about 4.5 years now.
Nice. Okay. So, tell me about a little bit about your journey into psychiatry and then a little bit about how you got into this niche of psychiatry.
Sure. I always thought I was going to go into anesthesiology. So when I was in medical school and doing my rotations, I was really planning to go into anesthesiology. And then psychiatry was my last rotation in med school, like my last core rotation. And I just loved it. It just took me by surprise. So I'm what you call the accidental psychiatrist, meaning I didn't really have plans
Yeah.
to go into it, but I knew I loved it when I did it. So I changed gears and have been doing that since. And so glad I did that.
That's funny. I feel like those are really like polar opposites. Like anesthesiology, you almost don't even have to talk to anyone.
Right.
Psychiatry, that's all you do. It's really
Right. It was
very interesting. So, how about what drew you specifically to like women's mental health and what you're doing now with your practice?
so in my residency, so I trained at the Cleveland Clinic and got exposed to many different subspecialties within psychiatry. And then I had my daughter in residency and through some of my own struggles during pregnancy and trying to navigate life, I realized that I really feel passionate about women's mental health and what we go through sometimes. And yeah, so that led me down that path and have been really trying to focus on it since then. Of course, I do some general psychiatry as well, but I really have a passion for women's mental health and how we can really get impacted by all the different stages of our lives as women.
Absolutely, absolutely. And you also have like an integrative approach, or I know there's like a certification for integrative medicine. Is that something you also do?
Yeah, I don't have the certification. I just really apply it in my practice. So I believe strongly in, of course, traditional medication, psychotherapy, using different therapy modalities, saying get out in nature is like part of the treatment plan and supplements, believe strongly in some certain supplements can be really helpful, exercise, strength training. Sometimes hormones play a role in how we're feeling, especially as women. So I try and really just go with a holistic approach and throw as much as I can that's good evidence and can lead to some good results for
I
individuals.
think you're giving all your secrets away in one sentence. So I guess where do you want to begin? I think you want to start with like women's mental health and kind of why that matters.
Yeah, I mean, as women, we have these unique circumstances in our lives tied to the reproductive life cycle and, going through perimenopause, a little later in life and the hormonal changes with that. But before that, for those of us who have children or experience pregnancy and loss, or we're dealing with the hormonal changes with that. And then even before that, with the menstrual cycle and premenstrual disorder, or even just having exacerbation of mood or anxiety symptoms associated with certain times of menses. So we can have really unique experiences that, are unique to women and I have some unique treatments or just recognizing that exists is really important.
Mhm. Do you also see adolescents?
I am not trained in adolescence, but I see a lot of young adults and
Mhm.
people throughout different stages of life.
Yeah.
Yeah,
So, I mean, how would you specifically say how hormonal transitions kind of affect mental health? Or you
sure.
can pick one phase if that's easier.
Yeah, like let's take, for example, going through the menopausal transition as we're getting older in our late 40s or, early 50s, we're starting to have changes in our hormone levels. Estrogen levels are overall declining. And, we know that estrogen has a huge impact on our mental and physical health. Estrogen impacts neurotransmitters such as serotonin and dopamine, which can impact our mood and impacts muscle and bone strength, and it just can really trickle into different parts of our lives, physical and emotional.
Mm-hmm.
Yeah.
As far as I think during menopause or perimenopause, even like people
Yeah.
are, experiencing a lot of, anxiety and depression, and there are
Yes.
many ways to approach it. How would you approach someone that's coming in with some of those features and maybe like perimenopause, menopause age?
Yeah, I would basically, ask them about their history, maybe their cycles, what they're experiencing, because, like you said, a lot of women might be experiencing anxiety and not even realize that it coincides with that transition in their lives. It's just something that,
Mhm.
for some women, it's the first time it's appearing or it's resurfacing now after being, in remission for a long time. And we'll talk about their history, their cycles, and getting a better understanding of where they're at, and discuss possible treatment options, which could involve antidepressants, of course, but it could also involve hormones or referral to their OBGYN for an examination and more in-depth investigation.
Yeah, absolutely. Sometimes you don't necessarily have to jump to the SSRI. It could just be, simply needing a hormone
Right.
back. Hormone replacement
Exactly.
can be
They need,
helpful
an
too to treat.
estrogen patch, or yeah, it depends on what they're
Yeah.
going through. And a lot of times they feel better just, after that,
Hmm.
or the two things are done, both things are done, an antidepressant and hormones, and they
Hmm.
work together to make, person get back to their optimal health.
Do you have any like specific case studies that you'd like to share on like a patient with that description?
Yeah. I mean, I see it all the time, with women who come to me in their maybe late 40s and be like, I'm having all this anxiety. And then I'll ask about their menstrual cycle and it's becoming less frequent, or, it's not as the same schedule as it once had been, right? They're not regular anymore. And we sort of reach that conclusion through, or not, but through some discussion. And then I'll sometimes even refer them to their OBGYN, and they'll get started on an estrogen patch and potentially sometimes even some progesterone. And through our discussions, we find out that it's not just like the night sweats they might be having, but they're also having trouble with sleep. And then, like we said,
Hmm.
anxiety and depression, and just kind of feeling different, sometimes cognitive fog, like, oh, my thinking is not as clear as it once was, which is another potential manifestation of going through the menopausal transition.
Hmm.
So,
Yeah, I mean, I think we hear that time and time again, but it's nice that I feel like it's getting more recognized for sure these days. So that's good. How else can hormonal shifts create kind of mood instability in women?
just the changes in the neurotransmitters.
Hmm.
We know that dopamine and serotonin and norepinephrine can impact how we feel, and having the hormones and sort of getting those levels back up, and sometimes even antidepressants can help build new pathways and treat the depression and anxiety that way also.
So when we were specifically talking about menopause, which neurotransmitters are
So,
affected?
serotonin, dopamine, those
Mhm.
are impacted by the estrogen levels that we have. Changes in estrogen levels can impact just through how these neurotransmitters are made, that
Mhm.
the changes in that will have an effect sort of on the levels of dopamine and serotonin.
Can you give the listeners like a brief description of like what serotonin and dopamine do for us?
Yeah. So serotonin and dopamine are neurotransmitters that have a lot of different functions, but they can play a major role in mood and how we're feeling. So when those levels are low, we can often feel depressed or more anxious, and just, feeling like dopamine is like involved in the reward pathway and feeling good. It's the feel good neurotransmitter. And so if those levels are low, obviously we're not going to feel as good as we once did.
That's a
Okay.
great, easy description for everybody to understand.
Yeah.
As far as, we think of SSRIs, which, are have to do with serotonin. Can you explain why you might use something like that? What does that actually do when you're saying our serotonin levels are off and you might use an SSRI?
Sure. So SSRIs are selective serotonin reuptake inhibitors, right? And what they help us do is, we've got connections in our brain and, neurons and the connections between neurons. What the SSRI will do is will allow for more serotonin to be around in those connections and have more uptake of, say, serotonin in the brain. And doing that will make us feel better. And if there's been any depletion or low levels, then trying to get it back up can help treat the depression that
Yeah.
it's
So you
feeling.
were saying like the synergy of, the SSRI with maybe menopausal hormonal treatment would help bring up those levels in general. And then that's why they're going to feel so much better with
Exactly.
having a better
Exactly.
balance of those neurotransmitters.
Right.
Awesome. Okay. So most people think about, therapy and a medication when they're talking about psychiatry, and you have this passion for barbells. So tell me, what is happening neurochemically when we strength train, or why is that important?
Sure. Yeah. I mean, it's important for so many reasons, just building like bone health and muscle strength, which are things that really start to go down as we, as we get older. And part of that has to do with the decreasing estrogen levels. But when we strength train, or even just exercise, right, we're releasing endorphins that sort of boost the endorphins and get a boost in dopamine and serotonin, right? So that's one way that exercise can impact our mood and make us feel better. I also, just the idea of, okay, I'm going to put aside this time for myself and exercise. I see that as part of your, self-care, and just giving yourself space and time. Just the acknowledgement of that and taking that time for yourself, I think, is really part of the process. Also being very intentional about looking after ourselves.
Yeah, I think sometimes you hear that story about someone who it's hard to get them motivated to exercise or start exercising, but once you get going, and then certainly once you finish, you get that, like, I don't know, example of runner's high, or something
Yeah,
like that. There, you just feel so much better after doing it. It's just
absolutely.
a matter of getting over that first little bit. Yeah.
Yeah, no, definitely. And then just, like, even, and a lot of times women, or, individuals might feel like, I don't know what to do. I don't have a routine. So I'll help them, with a routine or a program that I might have done myself. I'll make those recommendations. And,
Mhm.
studies have even shown that just 10 minutes of strength training, even 3 times a week, can have an impact. So it doesn't have to be this complete overhaul of your schedule.
Mhm.
It's just building some capacity and time to just fit these little bits in that you weren't doing before. And I believe strength training can have a very slow cumulative effect. And with time, you'll start to see the benefits, and without feeling like you've had to rearrange everything.
Yeah, I mean, strength training, like you said, slow cumulative, right? It's more of a, you got to be consistent with it to reap the benefits from it, right? And one of those benefits might be, better muscle mass. So how would you say muscle mass like influences mood, and kind of combined with like insulin resistance?
Yeah. So, building muscle mass will help decrease the insulin resistance that we
Mhm.
have. And that's achieved through the strength training, like building our muscles and having less resistance to insulin can definitely help us feel better, keep our blood sugar levels more stable, and just build, keep bone strength, maintain our health, less likely to suffer from fractures and, things like that if
Mhm.
we fall. And it's all just kind of I hope I'm answering your question, but just kind of a buildup and accumulation of those things.
No, I know. I kind of like went on a topic of insulin resistance, which,
Yeah.
is for listeners, is like a precursor or part of prediabetes, diabetes.
Yeah.
But I was wondering, like, do you see people who have a lot of like sugar glucose fluctuations and not controlled, like diabetes or
Yeah.
prediabetes, that impact their mood?
Yeah, definitely. Having fluctuations in our glucose levels it can definitely impact our mood, right? Like if we're having
Mhm.
these highs and lows, it can certainly coincide with not feeling as well. The other thing is, as we get older, especially as women, like I start to see the A1C start to creep up, right? With as we
Mhm.
start to go
Yeah.
through that transition and decline again of estrogen can make us more susceptible to insulin resistance.
Yeah.
Yeah.
So, I mean, insulin resistance is also related to some inflammation, right? And
Yes. Yeah.
elevated weight is related to inflammation as well. How does inflammation play a role in depression?
So we know that individuals who are chronically depressed can have like a low grade inflammation. We've seen it from the
Mhm.
studies. And so
Okay.
inflammation kind of puts through like this, the inflammatory cascade can certainly lead to feeling depressed and not, just decreasing those neurotransmitters, and again having that cascade where you're not feeling as good, physically and emotionally.
Yeah. So I'm hearing, strength training in particular
Yeah.
can improve insulin sensitivity, lower inflammation, improve
Right.
mood. Any other
Right.
benefits? I mean, I know you mentioned bone health and things like that, but any other
Yeah.
like physiologic or psychological benefits that
Just
we see?
again, from the increase in neurotransmitters that we're able to get, like we know exercise boosts and causes a rise in the endorphins, which again make us
Mhm.
feel better, so that's another huge part of it. And then just being less susceptible to injury and just having a better quality of life, being able to carry our own groceries, like just later in life, that's like a big thing, right? So being
Yeah.
able to do all of that and our quality of life.
Would
Yeah.
you say it also has like a better adaptability to handling stress and stressful
For
situations as
sure.
well?
For sure, for sure. And with inflammation and with stress, we get the increase in cortisol, right? And when
Hmm.
we've got as our estrogen levels drop, we can have rising levels of cortisol. Estrogen itself is also anti-inflammatory. So as we get a reduction in estrogen, we've got more inflammation, more cortisol. So it can be a bit of a vicious cycle.
Yeah.
Yeah.
What about, I mean, I know sometimes we say exercise and I guess resistance training as well improves sleep. So how would that
Yes.
affect neurotransmitters or and everything else?
Right. Sleep, that's the other thing. A lot of women, as they're declining estrogen levels, it impacts their sleep and an ability to stay
Mhm.
asleep. So when that goes away, and sleep is a restorative process, right? So as we sleep, our body's restoring, we're making more neurotransmitters, we're healing, we're getting rid of the bad stuff, right? And if we have less sleep, we're not able to focus on those things. And again, we feel the negative effects of that.
Mhm.
Yeah.
What about like executive functioning and things like that? Does that play
Yeah.
any role?
Yeah, I mean, that's why I think women, like sometimes when they're going through that transition, they might feel that cognitive fog and they might not
Mm.
feel as sharp as they once did, right? And so sleep is also a time when you're resting so you can have better executive functioning. We all know if we had a bad night's sleep, we're not operating on all four cylinders, right? The
Right.
next day. And I think that's kind of a good analogy to think about.
So
Yeah.
you said 10 minutes, like 3 times a week of strength training is impactful in many ways. Is that really enough? Like, what would you say?
I think it can be a slow cumulative process, and I think that if you're not doing any of it and you do that,
Mhm.
I think it's enough, right? I think that
Mhm.
we have to meet people where they're at and where they can actually implement. So I would rather someone implement the 10 minutes 3 times a week, maybe having an option to do 20 minutes if they have time, or 30 minutes if they have time. But I think that 10 minutes 3 times a week is 0 minutes any time of the week, so I think, and that's why I'm saying it's like a slow cumulative effect of building muscle and
Mhm.
regaining our strength. I think that, and if people are more likely to implement that when it's doable in little, bite-sized pieces, then I'm all for it.
Mhm.
Yeah.
What about, is body weight enough, you think, or what would you say?
Well, you want to body weight. It's not just body weight, but it's muscle and muscle mass. And
Mhm.
sometimes people will do things like body scans, right, to see how much
Mhm.
fat there is, or because even with estrogen, or you could have a higher fat percentage or high, when as our estrogen levels go down, we're more likely to have higher visceral fat. And so what we want to do is, it's not just the weight, but it's, what does the weight consist of? Is it more muscle? Is it, so you want to see that
Mhm.
muscle mass go up and be comprised more of that weight.
Do you do any like body composition in your practice or anything?
I actually don't get down
Mhm.
into that level of detail, but I know, you can certainly do that. I have one like that I use at home just to measure mine, and I do, my
Yeah.
strength training program. So, what I try and do is just give my patients the tools to be able to follow or pursue some of those things, and I'll tell them about the body scan, but I also don't want them to be totally focused on the
Yeah.
nitty gritty if it's going to be overwhelming. I would rather them just do the strength training and then see the benefits of that, and the rest usually follows.
Mhm.
Yeah.
Yeah. So in our practice, we do use the body composition, and I don't really
Yeah.
see anybody getting like overly obsessed about it, thank goodness. And I think it's always been in like a healthy way because it's like once
Yeah.
a month. You're not necessarily doing it every day, right?
Right.
And they're seeing changes when they're doing physical activity. So it's like very
Yeah.
encouraging. I
It's
think it's a
motivating.
nice,
You're absolutely
yeah,
right. Yeah.
yeah. So it's a nice feature. So I was going to switch to like the integrative part, but if you want to, did you want to tell us anything else about like resistance training or anything else that might be connected to that, I guess, subject of your practice?
I think if you find a program that you like that's consistent and gives
Mhm.
you options. So one of the programs that I often recommend is, I've partnered with Dr. Ali Novitsky, and she's a big, physician health coach, and I follow her programs. But my patients or anyone else who's interested, I have an app called the Fit Collective app, and we offer, the strength training programs in very bite-sized pieces. There's, one workout for every day of the week, but you can choose different lengths of workouts depending on what your day is like. So I think just having a consistent schedule, whatever program you follow, is very, very important. Just pick something and be consistent with it. Pick something that has good, good exercises, and and offers some things like yoga and meditation and some other like days where you might need a little more of that.
Mm-hmm.
Yeah.
Mm-hmm. Yeah, I mean, it doesn't always have to be like hardcore weights and hit and all
Right.
that all the time, right? Absolutely.
Absolutely.
Mixing it up is very helpful and needed, right? For
Yeah.
healing too. So tell us a little bit about the integrative approach. I know you kind of already did a little bit earlier, but how do you bring that into your practice?
Sure. Depending on what's going on, if someone is struggling with anxiety or, depression or sleep, I will, offer treatment modalities that not necessarily have to do with traditional medications. So, for example, let's take sleep, right? One of
Mm-hmm.
the things that I like to talk about and, talk about different apps or options, I talk about sleep hygiene and improving our sleep practices. Because, like we mentioned before, getting a good night's sleep, good quality sleep, and sleep is also promoted by having what we call good sleep hygiene. So I'll talk about those things, like
Mm-hmm.
try not to look at screens before bedtime, and the bed or the bedroom being a comfortable, relaxing space that's really meant for sleep, and not bringing your laptop to bed, and having a consistent bedtime or getting into bed when you're actually tired and not tossing and turning. So we'll talk about like sleep hygiene. I'll talk about programs like cognitive behavioral therapy for insomnia, CBTI, and what's out there. So that's one approach besides, just medications, which could include traditional medications, or I might talk about melatonin or L-theanine as other options for, or magnesium. There's different options that, some might work better for others that we talk about.
Mm-hmm. Do you do CBTI, the CBT for insomnia?
I don't personally do it, but I have
Mhm.
programs that I might refer to. There's also free resources online that I'll give to my patients about
Mhm.
that if they're interested in it. Yeah, for sure.
Nice. Okay. So you also mentioned, getting outside and the power of nature, and
Yes.
tell us more of how that plays a role in everything.
A lot of times we're so busy, we're inside, we're stuck behind a desk. But, we know from studies, even just going out into nature, being among the calm, can have a positive impact. Again, releasing endorphins, getting out of that stress. Being in nature can also, reduce cortisol levels and that stress response. So there is actually like, I think it's in Europe, they have a prescription for nature, they call it, where you get outside and go into nature. And it's also part of your treatment plan.
Yeah, I obviously love going outside, but
Yeah.
my sister recently was going to Sedona, and man, those pictures were
Uh,
like gorgeous. I'm like, oh my God, I need to get out there. That's going to be my goal. But
right.
yeah, but even you don't have to travel across the country or world to go
Oh,
outside in nature, right? So even if you live in a city, I'm pretty sure you can find that somewhere, right?
yeah.
And go for a walk or
Feel
beach.
the feel
Yeah.
the breeze, like
Yeah.
feel the natural breeze. And
Mm-hmm.
exactly. And and being in nature could be part of your exercise. And the other thing I want to like,
Mm-hmm.
mention is that exercise not only releases endorphins, but it also helps increase BDNF, which is the brain derived neurotrophic factor, which increases what we call neuroplasticity and making new pathways among neurons, and then also enhancing mood that way also. So just so many benefits of exercise and going into nature.
Yeah, another, I guess chemical mechanism of way that's
Yes.
pretty neat. Yeah,
Yes.
that
Yeah.
they've studied. So it's nice to see like, these, scientific things that are reporting back on what actually changes when you do these things and why
Yes.
you feel better, right?
Right. And just having that evidence. Exactly.
Yeah.
Yeah.
So one other thing you mentioned was something I'm horrible at, and that is scheduling time to do nothing. So why
Yes.
is doing nothing
Yes.
so hard for some people?
Because we're in this fast-paced world of we always have to be doing something, or I think people feel guilty when they take some time to themselves. Like I start my morning, every morning I start with one cup of coffee and I sit down in my living room with my dogs and just kind of just sit there for 10 minutes and just have that time to kind of wake up. And I don't try and make lists or think about what I have to do that day. I just kind of am there with my dogs and just having that nice downtime before my day gets going. And I know that if I don't have those moments, my day's a little different. It just doesn't
Mhm.
feel as relaxed, but I feel like
Yeah.
just having that grounding moment in the morning really, really sets the tone for the rest of my day.
Mm. Yeah, I was discussing with a concussion patient recently that, he needed to have cognitive rest. And I'm like, he's like, well, what do I do? I can't go on the computer. I can't go on the, like, watch TV. I can't even read, like, what do you do? Like, He doesn't that, I mean, that younger generation definitely didn't understand. I don't think it's just the young generation. I think it's everybody. I just think I find it a challenge to do nothing. So
Right. It's
it's
so
better
hard.
to
It's so
schedule it in.
guilty. Exactly. Schedule in self-care or alone time. That's what,
Yeah.
put it in your calendar.
Yeah. So let's see, I mean, is there anything else that you wanted to add to everything else that we've been talking about? And did we miss something or?
No, I was just, if you're going back to integrative approaches, like even
Yeah.
for anxiety, I might recommend some supplements, or for depression, we know that things like omega-3s can have a huge impact on mood. And there's a lot of evidence
Mhm.
for that now, and even from randomized control trials. So just things like that in my integrative practice that I really like to weave into the treatment plan.
So we were mostly focusing on like perimenopause. I know
Mhm.
we briefly talked about postpartum, but what about for the older patients who are beyond that? Is there any sort of integrative approach for, in preserving cognitive function and mood in older generations, not generations, older ages?
And yeah, I think it consistently comes back to exercise as being one of the most beneficial and neuroprotective things that an individual can have in their lives, and a lot of times people might say, what, is there a treatment for dementia or preventing
Mhm.
dementia? And we know that exercise can not only like I don't know if it can help prevent it, but it can certainly decrease the onset or its progression. So
Mhm.
there's a role to be had with exercise at any stage in life. Of course, you have to do it within reason and your capabilities, right? Like, so I'll tell some of my older patients, like, even chair yoga or chair exercises, right? Like, they might not have the same stability and balance, but meeting yourself where you're at physically, and just trying to do that, of course, is very important. And making sure that you follow a plan that's in line with your physical capabilities, and maybe, having a consultation with your own physician or, care team to see what would be a good plan for you is really, really important.
Yeah, absolutely. I think, we had another guest on who was like a specialist in Parkinson's, and she said like they get out there and like box and everything like that.
That's
I think
right.
it's
That's
amazing.
right. Yeah.
Yeah, really good.
There are
Yeah.
exercise classes for older individuals that are,
Mhm.
having some of those neurological disorders, and those are
Mhm.
intentional classes, maybe 3 days a week, 3 mornings a week, where they can
Mhm.
go and do specific exercises.
Yeah, I think that Silver Sneakers program also really helps
Right.
them, find
Yeah.
locations and programs that they can do it too. So I always kind of recommend that, assuming that their Medicare thing pays for it. I don't know all the
Right.
details, but
Right.
it's
Yeah.
helpful.
Or Tai
Yeah.
Chi. We know there's some really good evidence for Tai Chi, and just prevention of so many things, and also treatment of conditions such as even fibromyalgia, or,
Mhm.
we know there's some really good evidence for Tai Chi.
Mhm.
Yeah.
What would you say is the biggest myth about women's mental health?
I don't know if it's just a myth or not enough. Like, a lot of times people think that going through the menopausal transition is it's just hot flashes and maybe sleep difficulties, but
Mhm.
it comes with a lot of other things, the cognitive fog, and there's even symptoms like frozen shoulder, or like, less mobility with going through that transition. So I think those are symptoms that maybe are getting a little more attention now, but I think that that's one of the, I guess, misconceptions, or just not having enough knowledge out there in the mainstream world to know that there's so many different symptoms, and not everyone's going to have the same symptoms. And I think that's a huge part of it.
Mhm. I think as long as these people like that continue, doing their advocacy work for menopause, treatment and recognition, I think we're definitely on the right path for that. And I'm sure you're inclusive in that. So
Yeah.
keep spreading the word. I know we had a recent podcast release too that was a lot of menopause focus. So as long as these people like this keep doing the work, I think people will start realizing that it's not a myth. Like they're going to learn what all the other things that can be associated with it, right?
That's right.
Yeah. So I think you already know to answer this question. If woman can only do one thing this week, what would you suggest to do? But
Yeah, take some time for herself. Find a
yeah,
routine, 10 minutes to herself every day, and
perfect.
look for a good strength training program.
Mm-hmm. All
Yeah.
right. So where can they find you if they want to work with you?
Sure. They can find me on my website, Healing Her MD, all together. And through there you can see my website. There's a link to a strength training program there also, and some other resources. I'm developing a strength and mindset scorecard. So working, so they can, download that for free and have that as a resource for themselves too.
Very nice. All right. Are you on social media at all?
I am. So you can
Okay.
also find me on Healing Her MD on my Instagram. It's on there
Perfect.
too. Yeah.
Awesome. Well, thank you so much for joining us today. This was a very fun episode. And I know we said earlier before we recording that you're licensed in all 50 states, but you're
Yeah.
also local in the
Yes.
Tampa Bay area.
Yeah. Yeah.
So
Yeah.
there's many ways that people can work with you, even if they're not in Florida. So that's
That's
exciting,
very true.
right?
Yes. Yep. Definitely.
Awesome. All right. Well, thank you so much for being on the podcast today. And everybody
My
tune in next week
pleasure.
for next week's episode. And get healthy, Tampa Bay. Take care.